Croup, welcome to the committee. Thank you for being with us. You have the floor.
Thank you. I want to thank you all for inviting me to speak today, for giving me the opportunity to share my lived experience with the methadone treatment and safe supply programs. I'm going to touch very lightly on one issue. My daughter, Larissa, she died in September 2020 from methadone toxicity, 12 days into her methadone treatment. I wanted to bring this to the forefront too because there's other ways of dying. This was at the hands of a doctor at Recovery Care here in Ottawa who did not conduct an opiate tolerance test on her prior to starting her on the methadone program, and unfortunately 12 days into her program she overdosed because of the dose that the doctor gave her 2 days prior. So I think it's important to know that methadone is a great tool to get a person on the path to recovery, but we also have to look at how it's dispensed and prescribed, and that the doctors prescribing this know what they're doing and not skipping any steps. But what I really want to talk about today and focus on is the protracted and lived negative experience with my son, who is in active addiction, and he's been under Dr. Charles Bro's care at the Byward Market Recovery Care location on Rideau Street since June 21, and on safe supply under Dr. Bro's care since the fall of 2022. He's prescribed 28 hydromorphine pills daily, in addition to his current dose of 45 milligrams of methadone. He was on methadone last year as high as 165 milligrams. He's still using street drugs. 3 years later, my son is still using fentanyl, crack cocaine, methadone, despite being with Dr. Bro and with Recovery Care for over 3 years. As soon as he was put on safe supply, he started diverting his safe supply, as most of the patients that I see coming out of this clinic on Rideau Street, I see them in front of me, coming out of Dr. Bro's office, coming out of the pharmacy, right in front of where I'm parked. I've taken pictures. They're counting out these white pills. There's a dealer's sort of come out of nowhere, and they hand them a little thing wrapped in plastic. I see them move a couple of feet, and they're smoking and injecting right on the street. This is my experience with safe supply, my experience with my son. I have gone in to see Dr. Bro myself personally, as is his father, over the last 2.5 years, asking for a treatment plan, asking for counseling, letting the doctor know that he's using fentanyl, that he's using crack cocaine. We're worried about overdosing. The doctor really didn't respond to anything. His answer to me was, my son is the one that has to ask for the treatment plan, not me. So the last couple of years, I have essentially been monitoring my son. I moved in with him. In fact, 3 or 4 weeks ago, I had to call 911 because he overdosed. This is all under the care of Dr. Bro, Recovery Care clinics. We're into it 3+ years. Why am I still calling first responders when these clinics, is my understanding, under SUOP, are receiving millions of dollars in funding, 10+ million to date. Their websites purport to have a treatment plan individualized for each patient, mental health counseling for each patient. They have one mental health counselor, to my knowledge, across 4 clinics, who only is available virtually more often than not. I'm not looking at my notes anymore, but essentially, as a lived experience, and as somebody who has observed what is going on outside of the Recovery Care clinic on Rideau Street for the last 3 years, the diversion I'm witnessing, not just my son, but the people outside the clinic, this is not working. I feel that safe supply has its place and can be helpful, but the dosage has to be witnessed. You can't give addicts 28 pills and say, well, here you go. They sell for $3 a pop on the streets. You've got drug dealers, I know this for a fact, through my son. I've seen it. They come to your home 24/7. You can call at 2 in the morning. They take your hydromorphine pills. They supply the crack, or the fentanyl's now down to $60 a gram. Used to be 120, 170. So addicts are like my son, who still wants to get clean through the type of care that he's receiving at recovery care specifically, because that's my lived experience. Dr. Bro, in my opinion, knows what's going on, because I told him that I suspect my son is diverting. I want to know why he's getting so many pills. Where's the treatment plan? Where's the mental health counseling? I need to save his life. 3 years in, I should not be calling 911. They're already overextended. In closing, what I want to say is I see no evidence of all this SUEP funding, which is taxpayers' dollars, yours and mine. I see no evidence of it being spent on treatment and recovery at recovery care for their patients. I believe that we have to move away from what is a harmful drug legislation model to a hopeful recovery-focused model where you've got detox treatment, you've got mental health treatment, you've got assistance in acquiring housing, employment skills. I believe that safe supply can only work if it's witnessed and dispensed and there's a treatment plan attached to it. As I said, I've been trying to keep my son alive for the last 3 years. He's been in this safe supply program. I have spent hours, weeks, months, his father and I, we've been looking for a treatment program. We've been looking for something that's based on recovery. And at this point, what we see is all roads point to the Alberta model. Thank you.
Thank you, Ms. Group.